Morning. Today is Tuesday, October the 12th, 2010. We're having our mandatory fall staff meeting, and we're going to start with the agenda. Number one, we have listed winter's right around the corner, so there's some things that we need to prepare ourselves for when we're going and traveling to see our patients. First of all, driving, when the road conditions are poor, you want to make sure that you leave a little bit earlier than you normally do. You want to make sure that your tires are in good shape. You want to make sure that you carry some extra supplies with you in a vehicle. For whatever reason, there are times when certain roads will close around Fayette County. Make sure that you have your cell phone, that you have a charger in case there's a problem. Always call the office and let us know if you're going to be late for a shift. We do have a snow day policy that kicks in whenever the weather conditions are to the point where it's unsafe to be out on the road. What we'll do at that point in time is we will provide care for the most imminent patients that we have, like a 24-hour case, or patients that are getting insulin shots that have to have someone. We will even provide transportation to those patients in a four-wheel drive vehicle. That's one of the ways that Twin Oaks Home Care is number one and stays number one, is because we're very dependable to our patients and to their families. Number two, infection control. This is a huge issue. Last year there were several new cases of the swine flu, the H1N1. The best way to prevent that is to continually wash your hands anytime you're out in a public area. If you have any hand sanitizing lotion, take that with you. Use it frequently. You have to be careful of what you touch. When you're touching door handles, when you're touching shopping buggies, anywhere you can pick this thing up, make sure that you're either washing your hands or using hand sanitizer. It's extremely important. What we have here in the office under 2B is an infection control log. If an employee or a patient gets an infection of any kind, it has to be documented. So we do have a log. If you guys call in and you say, hey, you know what, I have the flu, it gets written down. You have the flu, whatever date. If you go to the doctor, we have your doctor slip to back that up. It's just one of the things, one of the policies that we have to abide by through the state. Number three, a new policy on child abuse clearances. If you're in a home and you're going to be providing care, because we are now a licensed agency, one of the requirements is that every employee that goes into that home where there's a child that resides there must have a child line verification done. We take care of that here. That's not something that you have to worry about. But there is a form that you have to fill out, and we will go ahead and have that. It has to be on file. If they come in and they do our audit, which they will, at least once a year, they will be looking in the charts for patients that have children in their home, and that which employees go there, and then they're going to pull the employees' records and say, okay, are we doing what we're supposed to be doing? Are we following the rules? And the rule is you have to have that child line verification done. So some employees, depending upon what home you go to, we may ask you to go ahead and complete that. If you're not in a home that doesn't have any children residing there, you're not going to have to get that child line verification done. So we will let you know if it's necessary. I will say this: if you're in a home and there's a child there, I would like for you to go ahead and call the office and report that. When the registered nurse goes out on admission and when the supervisors go out and do spot checks, we are checking that. That's one of the questions that we asked, like on the home safety flow sheet. Are there any children residing in the home? And things could change. People move in and out. Their grandkids could move in with them. And if that were, wherever the case, you're in a home and there's a child, please contact the office to let us know. Number four, we've had issues in the past, none recently, but I still thought that this needed to be brought to your attention, where an employee had a purse in the patient's home, and they had money in their purse, and that money came up missing. And there were other people that were there in the home. You know, there's really nothing I can do unless you actually see someone take it. There's nothing that anyone can do. So the best thing to do is to prevent that situation from happening. So if you leave your purse in your car, or your whatever else you carry in that has something valuable in it, just put your keys in your pocket to get back into the vehicle. That would be sufficient enough. Also under 4 is not only to leave your purse in your car, but leave your personal problems outside the patient's home. When your dog dies and your spouse left and your kids are being bad, those are things that could really hinder your relationship with your client and with your client's families. So what we need you to do is to be professional. Whenever you go in, you can divulge a little bit of information. Do you have children? Yes or no. What's their ages? Yes or no. But that's pretty much the extent of it. You don't want to get into personal issues with your patients and families. They can actually turn that around and use it against you later on. Or they could dislike you because of certain personal issues or certain personal beliefs that you have that they don't have. So, as a rule of thumb, leave your purse in your car and leave your personal problems outside of the home. Number 5, our annual TB training. We do that every fall. In 2005, as I was researching this, in 2005 there were 14,093 cases of tuberculosis in the United States. In the range from 93 to 2000, 7% of Americans had tuberculosis, been exposed to it. Well, from 2001 to 2005, the following 4 years, that dropped from 7% down to 4%. So it has declined. That's a good thing. That's our goal. We want to actually eliminate it like we have with other illnesses and diseases. But what does that mean, 4%? That means that 10 to 15 million people have what's called latent TB. Latent TB is someone has been exposed to it, but they don't have the active TB. They're not contagious. And that's why we do the skin tests, the annual skin test. If it's a new employee, we do a 2-step skin test. Once a person tests negative, they don't have to have the 2-step every time. They just have to have a 1-step. Out of those 10 to 15 million people that have what's called latent TB, 10% of those, or 1 out of 10, will develop what's called active TB. So that's why we have to continue to monitor that. Active TB is when the TB inside of a person's lung is no longer encapsulated. It has opened up, it's flourishing inside their lung, it's producing mucus, and when they cough and they sneeze, the bacteria from that comes up and out, and through those air droplets, it's able to be given to other people. If someone had active tuberculosis, if it was an employee, that employee wouldn't be able to work until they were treated with antibiotics and it went back into remission. If it was a patient that had active TB, you would know ahead of time, we would tell you, and you would have to wear a mask. And you would have to, of course, observe your hand washing skills that would be necessary at that time. That's U.S. statistics. I found 2 other things that were really, I thought, just amazing. Asians. What percentage of Asians have latent tuberculosis? 95% of all Asians have latent tuberculosis that live in Asia. And in Mexico, 75% of Mexicans have latent tuberculosis, which means 3 out of 4. That's a really high number. And again, 1 in 10 will develop that active tuberculosis. Okay, policy number 6 on the agenda is a new policy. Again, as being a licensed agency in the state of Pennsylvania, we have to provide services for patients who may not speak English. And we do that in several ways. There is a policy in effect, and I wanted you to be aware of that. We provide picture boards. We provide a phone service that's a translator service. So I don't want you to think if you're ever in a home, and we have had a patient that did not speak English. He spoke Farsi, which is like up in the mountains of Iran, that we had to have a translator service. So I want you to know that it's there, it's available. You may never use it, but at least you know that it is available. Number 7, schedule changes. We've covered this in the past. It's black and white, and it's plain and simple. A, you must work your assigned shift. If you're scheduled 10:15 to 2:15, then that's the time you need to be there at the patient's residence. B, any change in that time must be called into the office before you leave the patient's home. Don't say, well, I'm going to wait until I get home and then I'm going to call, because chances are you'll forget, and that's what happens. You call before you leave the patient's house if the time changes, the stop time. It may not be you're leaving early, it may be you have to stay later. And that's fine too. We have a master schedule here in the office, and it has to correlate with your sign in and out times in the home on the monthly flow sheet. C, you must sign in and out correctly and accurately, and you're only allowed to use black ink, because when it needs to be photocopied and when it needs to be faxed to the state, only black ink will work. So that's our policy, black ink only. Number 8, online classes through the Pennsylvania Home Care Association, My Learning Center. I do have handouts that I will give you for that. There's about 30 online videos. It's for you to increase your knowledge and your expertise. You're able to view that at any time online. It's above and beyond the 75-hour home health aide certification that we already provide. And I will give you a brochure that's from the Pennsylvania Home Care Association, PHA. Number 9, make sure that returning phone calls for extra work assignments, make sure that you're returning calls. Our policy is you have to have either a voicemail or an answering machine. That's so we don't have to call someone 20 times to try and get a hold of them just once. It's being effective with time management. That allows us not to waste it. If you're off and you tell us you're available for a shift or you're available that day, when we call you and say, okay, hey, we need you, don't tell us that you're not available at that point in time. So if I understand there are times when things change, but if I have a secretary that's on call, an after-hours supervisor that's on call, and they're counting on someone, I don't want them to be put in those situations. Really makes them pull their hair out at the last minute when there's a problem. Okay, number 10, the HIPAA policy. That's the Health Information Protection Privacy Act. That was established in 2003. All patient information is strictly confidential. When you're discussing any client with other employees, make sure that no one else can hear your conversation, or you can use the patient's first name only when you're discussing the client. If there is a violation of this, you have to understand it's a federal law. There are federal charges that can be brought against the home care agency and the home care providers that work for the agency. So is it important? Yes, it's one of the most important things that we do. We not only protect our client physically against harm from themselves or from other things around them, we have to protect their information. Identity theft is on a rise. You wouldn't believe it if I told you. But we have had instances in the past where there's been identity theft in our clients, so we have to be very careful. We've made changes that we need to make. We used to have their social security numbers and date of births out in the homes in our folders, but we've had to change that policy. It's no longer out there. It's not easily accessible. We have a room in the back of the office. Everything's kept in a locked file cabinet. The room's locked. Our fax machine is in a secure location. So, the office does everything we can to protect their information. The employees out in the homes also need to protect the patient's information as well. Number 11, we have our holiday rotation, and because the fall's coming up, the most important holidays are coming up with it. Employees are required to work every other holiday. If you work Thanksgiving, then you know you're going to be off Christmas Eve. If you are off Thanksgiving, then you know you're going to be scheduled Christmas Eve. Best part about this is, and I have to be honest with you, probably 20% of our patients maybe will get holiday services. If not their full shift, what they'll do is they'll decrease their time on their shift, or they'll move their shift so that it's not really on the holiday, it might be the day before. Because I believe you need to spend time with your family as well on the holidays. And a lot of times they have their family coming in on the holiday. So that's a good thing. You know, our agency probably runs at 25% on a holiday. So that makes it easier. That way you guys can enjoy it. If you do work a holiday, it's paid time and a half. So that's one of the benefits of it. B, the holiday rotation is as follows: Thanksgiving, Christmas Eve, any shift starting 3 p.m. to 11 p.m. Christmas Day, all day. New Year's Eve is a separate holiday, separate from New Year's Day. And then Easter, Memorial Day, July 4th, and then Labor Day. Those are the major holidays. Those are the ones that we observe, and those are the ones you get paid time and a half on. Number 12, office hours. Our office hours routinely are Monday through Friday, 8 a.m. to 4 p.m. We are available 24 hours a day if there's any urgent situation where you need to talk to us. We tell families that as well. You know, if the patient falls and they're in the hospital at 10 o'clock at night, they can get a hold of us. That way we can get a hold of you, and you're not going to, go out of your way and drive there in the morning and knock on the door and no one answer. The phone numbers are listed: 438-1936. That's for local calls only. If you live outside of the Uniontown local calling, there is a toll-free number as well, the 1-866-566-9214. If you're in a home and there's an emergency, you don't want to dial the office first. You want to dial 911 first. Get the patient what they need right away. The patient stops breathing, or the patient's laying on the floor. You call 911 first. Then, after the ambulance gets there and they have the situation under control, you may have already started CPR. You call the office afterwards. Okay? And number 13 is the 2011 pay calendar that is attached to the agenda. Employees are paid on the 15th and the last day of the month. So it could be at times where your pay is a 14-day pay. There's times when it's a 16-day pay. If it falls on a Saturday, it would transfer over in the bank accounts on a Friday. If it falls on a Sunday, it would transfer over on a Monday. If it's a holiday, we try to do it the day before the holiday. Number 14. I've seen this in the past, and this can cause problems. Do not give your phone number out to any of the patients or family members, because what will happen is you're going to be off, and they're going to call you on your day off, or they're going to call you in the middle of the night, and we've had it happen. So the only way for me to prevent this is to tell you, do not give your personal phone number out to any patient or family member. Number 15, notes left in the home. I have seen this on occasion. I think we've been pretty clear about it. Any note left in the home must be pre-approved through the office. There are times when it's important. You have to let the next person coming in know something about the patient. We want it to go through the office as to how it's worded, and we want to make sure that you sign it. And then what you'll do is you'll put the person's name at the office that you talk to. If you talk to me about it, you're going to put the note, the sentence, you're going to put your name, you're going to put my name, you're going to put a date on it. That way everyone's going to know, yes, this is what I need to do, and yes, the office is aware of it. B, employees must look at the patient chart prior to every shift when you walk into the house. First thing you do is wash your hands. The second thing you do is go look at the patient chart. You can say hi to the patient and ask them how they're doing as you're looking through the chart, but you want to make sure there's no notes in there for you, something that you need to know for your shift that's important. C, you must follow the directions as stated on the note. And D, call the office if there's any questions or changes. You know, sometimes those notes are outdated. Sometimes things change. We're not doing it that way anymore. So if there's a note in the home and it no longer pertains, please call the office and let us know, and we'll let you know what you need to do with that. We'll either have the supervisor pick it up when they're coming around to pick up paperwork, or it might be something that can just be discarded. Number 16, hired and non-owned auto insurance. This only pertains to employees that are transporting patients. If you are transporting a patient to a store or to a doctor's office, we have a list here of the patients that are able, of the employees that are able to do that. And the reason being is our insurance that we have kicks in, but it'll only kick in if you have a certain amount of liability insurance on your own vehicle. So I can't have a, say that number is $100,000. Well, say you only have $50,000 on your vehicle, then you shouldn't be transporting patients. It has to be at the limit that the insurance company requires. So that's what the secretaries do. They gather that information. They'll get a copy of your insurance that shows the declaration page that shows, yes, this is the employee, this is their vehicle, and this is how much insurance they have covered on it. That way our insurance companies are happy. That's the only reason. Number 17, we do have a safety committee and we have a performance improvement committee that meet once a month. The safety committee, we have forms that where the supervisor or the safety committee person will go out into the homes. They do what's called a home safety checklist. And when there's a problem, that comes back in, it comes straight to my desk, and then we try to get that problem resolved. Whether it's a problem with falls in the home, with fire safety, if it's a problem with, there's no handrails, maybe the steps are bad, there's no fire extinguisher, or there's no smoke detector. Those kind of things are really important in keeping our patients safe. Every once in a while we have to rotate who's on the safety committee. I like for people to sit on it for about a year. If you're interested in helping us with the safety committee, all you have to do is let us know. And then when the next time a slot would open up, we would invite you to come. You get paid. You come, you sit into the meeting. It's usually an hour. And you're required to do 2 home safety inspections every month at a minimum. And you get paid for doing those also. Number 18, the Twin Oaks Home Care brochures and business cards. Make sure that you're handing those out. Again, that's how our company has grown. We found that if you advertise on the radio or in the newspaper, it's not effective at all. It's nice to see your name up there, it's very prideful. Here's our company and here's the advertisement. But we get no phone calls. And our business grew from word of mouth and from employees that are out and about in the public, and you help someone that's elderly and you tell them about us and you hand them a card and you say, I hope you never need us, but here's a card just in case you do. Or if they know someone that needs us. Along with that, if you know someone that's interested in a job, you can hand them the card, have them contact our office directly for an application, or now we have the twinoakshomecare.com online where people can apply online. There is still a sign-on bonus for an employee referral incentive bonus for employees. If you find someone else that would come work with us, they work with us for 6 months, you get a bonus. So that's an incentive to help us grow and to keep employees staffed appropriately. Next is the number 19. I had mentioned in a previous staff meeting that we need to continue to be respectful. I feel that a lot of companies, even the communities that we live in, there's a sense of lack of respect. And the only people that can change that is us. So when we're in a patient's home and we're dealing with patients' families, we need to be respectful to them, to their property, to their family members, to any guests that come in the home, to my office staff, to the secretaries that are here. I expect them to be respectful to the employees as well, including the patient, family, even patients' animals that are in their home. You know, we're not supposed to be taking care of their animals, but I expect us to be respectful to them. If it's a situation where there is a family or a patient or an animal that is causing us problems, we need to know about it, because there are workplace violence situations that would occur that we would have to address. And I'm the person here for you to see. Number 20, Aflac Insurance. Twin Oaks Home Care does offer Aflac Insurance. It's a medical reimbursement program. It's a very good health reimbursement program.